What is an FUE hair transplant and how does it work? So FUE is a technique where we take individual hair follicles from the back of the head, which is classed as the donor area, and then we transplant those into the recipient, so the area that needs the hair, whether it's the crown, the hairline, or the front third region. It's a newer technique from the older technique, which is FUT, which is where they take the strip of skin out. But the difference with this technique is that using an instrument, we take micro follicles out and we take individual follicles to transplant back into the hair. What is the average size of a hair transplant? The number of grafts that are required is completely dependent on the person's level of loss, so whether that's the hairline and temples, whether it's the entire front third, or whether you're treating the crown and the top of the head. Now there are limits to how much we will extract in one procedure. So again, we may find that doing an area like the crown takes us up to those limits. But I'd say on average, the procedure would be anywhere between 18, 19, 2,000 grafts. Once you get to the 3-month stage, that's the point where you'll notice that the bruising has disappeared, the redness has disappeared, and by then you shouldn't notice that you've had a hair transplant. So the 3 main side effects of finasteride are reduced mood, low libido, and difficulty having children. The company that makes Propecia, which is a brand of finasteride, they claim that the percentage is about 1%. I think it's probably a bit higher than that. I think within my own practice, I've seen probably about 10% of patients, but that still means that if 100 people take the medication, 90 of them will be fine and 10 of them may get the side effects. Now, if you stop the medication, those side effects should disappear. So what we know of male pattern hair loss, this part of the head is a bit that's sensitive to testosterone, which is why men will thin here, where they keep this bit which is resistant to testosterone. Finasteride works by blocking an enzyme called 5-alpha reductase, and what that does is it converts testosterone into something called DHT, and it's the DHT which attacks the hair follicles. So by blocking that enzyme, you're allowing the hair to grow thicker. Are hair transplants a one-time fix? There are a couple of reasons why patients may need to have more than one procedure. One of those reasons could be if a patient is extending or if their progression hasn't yet stopped, so they progress further past the transplanted area, which means you then need to have more surgery to fill those new gaps. Another reason why a patient may need to have another procedure is they're trying to achieve what we call pre-loss density, which is trying to get back to the sort of density it was before you started to lose hair, and that also can take more than one procedure. In terms of the recovery of a hair transplant, again, there's 3 main things that you go through. You get redness, swelling, and the bruising. Swelling is the first thing to disappear, so that's usually 3 or 4 days after, can descend down the forehead. Redness on the donor area takes about a week to disappear, but then the thing that will last the longest is the bruising of the skin. So that can again last between 6 to 8 weeks, and then you can get redness for another couple of months after that. In terms of work, usually we say to patients, if you work in a trade or a dusty, dirty environment, we'd ask you to take about 2 weeks off work. But if you work within an office, a relatively clean area, then there's no reason why you can't go back to work after about a week. Will the transplanted hair look natural? So the aim of every hair transplant is to have a patient look as natural as possible. Now that encompasses a couple of things in terms of the design, how you implant the hair, the direction of the hair. There's a lot of techniques that go into making a hair transplant look as natural as possible, but that is our main goal, to make you look as natural as possible. Are there any risks associated with hair transplants? As with any surgical procedure, there are risks, things like bleeding, bruising, persistent numbness. That will be the same with any sort of procedure. The majority of patients though will have signs and symptoms for a few months and then they will disappear. Can women undergo hair transplant procedures? So women can have hair transplant. The technique is exactly the same in the sense we take hair from the back of the head, transplant it into the area of need. The slight difference can be the size of the area, so if someone's willing to shave the entire back of the head for the procedure, or whether you have to trim a very thin, small area, that can limit the number of grafts and also then what area that we can treat in terms of the size in female hair transplants. So how long does the hair transplant procedure take? We usually like to have procedures completed within about 6 to 8 hours. Now, depending on the size of the procedure, it could be towards the longer end of that scale, but usually within sort of 6 to 8 hours, we like to have it completed. So what makes total hair restoration different? In terms of hair transplantation, there's a lot of planning that goes into a hair transplant. It's not just a quick fix. You have to think about your future progression. We need to think about things like the family history. That's one of the things that we consider total hair restoration, and we make sure we've got a plan going forward, not only in the next 12 months, but also over the next 5, 10 years. And it's accessible, expert healthcare at a fair price.